Hello everyone, in this video we are going to talk about the last session of the inquiry. The inquiry related to the leukorrhea, related to the men's problem, related to the children. Firstly, we're going to talk about leukorrhea. Leukorrhea refers to vaginal discharge. Physiologically, the leukorrhea has no color, no odor, and very small amounts of discharge in the vagina. If you see the significant increase of the volume of leukorrhea, then it is considered as pathological condition. In the pathological condition, we need to ask about the color of the leukorrhea and also the odor of leukorrhea, because the different colors and different odors can indicate different pathogens. The amount, the color, the property, and odor. In the certain situation, such as ovulation, menstruation, or pregnancy, the leukorrhea may increase physiologically. So these situations we won't consider as disease. That's the physiological condition for ladies. The white leukorrhea, some white and a lot of leukorrhea with no odor. That's due to the cold dampness of yang deficiency. Some white and a lot perfuse. A lot of, in terms of the volume, why they have a lot of leukorrhea. Leukorrhea is the fluid, is the body fluid, although it is discharged from the vagina. It's also a kind of body fluid. The thin fluid, large volume of fluid. Do you ring any bells in your mind? Thin and large volume. That's the coldness. Because the coldness, the pathogen of coldness will not consume the body fluid. That's why you have a lot of fluid in the body. Okay, so this is very similar to the other pathogens. Wherever you see a lot, wherever you see thin, that's coldness. The coldness can be the pathogen, it also can be the yang deficiency. And it might have no smell. For the yellow leukorrhea, caused by the damp heat, so thick. Why the leukorrhea become thick compared with the thin leukorrhea? That's because of the heat concentrate the leukorrhea. The heat concentrate the fluid, then the fluid become thicker and become yellow. That's because the heat, the fire, burnt the leukorrhea, change into yellow color. You see here, from the video, we try to help you to understand these symptoms or these signs from the patient. We use the theories, basic theories to understand. So in future, when you see thin, a lot of fluid, this body fluid, now we talk about leukorrhea, is the discharge from the vagina. That's due to cold dampness. Then in future, when we study the other pathogens or the other symptoms, when you see thin, white, perfuse, phlegm in the lung, what's the reason? What's the cause? That's the same cause, cold dampness, will cause the thin, white, and a lot of phlegm. Okay, So if you see thick yellow phlegm in the lung, that's also due to damp heat or due to heat. So no matter what kind of discharge or what kind of fluid in different area, the thickness, the yellow, the color can help us to identify the pathogen. That's why we need to ask about the property, the color. So from the beginning of diagnostics until now, we use different examples to help you to understand the symptoms that we can see, and we use our theories to explain. So don't only limit to here, such as if someone they sweat, if their sweat can dye their t-shirt. After sweat, their t-shirt become yellow. What happened to them? Also damp heat. If a patient presents with yellow color, yellow coating on the tongue, what happened to them? Also heat, because the heat will burn the stuff, will burn the substance to be yellow. The yellow compared with white. Yellow also yang, white is yin, compared in terms of the color. Okay, so that's how to understand the different colors. The pink leukorrhea refers to white leukorrhea that contains the blood, often caused by stagnant heat in the liver meridian. So this is actually refers to the bloody. It can be a little bit blood in the leukorrhea. The last one is the multiple colored leukorrhea. Multicolored refers to brown-gray vaginal discharge with unusual strong odor. This situation is not common. Not common. If the patient presents with this situation, especially with strong odor, you need to be careful. If they present with unusual strong odor, you need to be careful. The cancer. In this situation, you need to send them to the gynecologist. Double check. So these are the discussion related to the leukorrhea. So for ladies, the questions apart from the questions in common with males and females we have discussed at the beginning. But for the ladies, we're going to add these two questions, which are menstruation and leukorrhea. The next session, we are going to talk about andrological conditions. So in this session, we actually talk about the men's problems, includes the impotence or erectile dysfunction, persistence of penile erection, inability to achieve ejaculation, nocturnal emissions, and premature ejaculations. So impotence or erectile dysfunction is an inability to develop or maintain an erection of the penis during sexual activities. The factors is also related to excess or deficiency. Excess can be the different pathogens affect the penis. The deficiency can be mentally. It can be depression of the 脏腑 organs, the situation from 脏腑 organs. So if it depends on the associating symptoms, kidney yang deficiency, the patient will present as ED, but they also will have other symptoms related to kidney yang deficiency, such as pale complexion, cold, aversion to cold limbs, cold hands and feet, soreness and pains in the waist and knees. So the pains and The soreness and weakness in the waist and knees. These are very typical symptoms of kidney deficiency. So whenever the patient tells you that they feel tired or they feel sore in the waist or in the knees, that's the very typical symptoms of kidney yang deficiency. The symptoms of the deficiency of the heart and spleen: palpitation, that's the heart; poor sleep, the heart; fatigue, the spleen; poor appetite, the spleen; fatigue, spleen qi deficiency. Symptom of liver qi stagnation: depression, the emotion; distending or stuffiness in the ribs area, qi stagnation; frequent signing. So when they sign, they feel better. That's a qi stagnation. The downward flow of damp heat, burning sensation, that's from the heat. Urine. The white turbid, actually it refers to the unclear. So our normal urine is clear, transparent. If the urine is not transparent, that's due to the damp heat. Stagnant blood. The patient may suffer from different the pains, injuries. So these are different associated symptoms. When you see this kind of patient with erectile dysfunction, you don't only focus on the ED itself, you're also going to focus on the other symptoms around all the body to conclude which organs is affected and then the treatment will be towards these organs. Persistent penile erection. This refers to an abnormal persistent erection of the penile mostly related to the fire. And related to the internal fire, related to the ministerial fire, which is the ministerial fire. That's the kidney yang. Nocturnal emissions or wet dream. This is a spontaneous orgasm during sleep that includes ejaculation. Physically, so a male unmarried adult or male adults who do not have sexual life, they will have 1 or 2 nocturnal emissions per month without other discomfort and symptoms. In this situation, it is considered as normal, but for frequent nocturnal emissions, you will, especially if the patient presents with fatigue, that's the pathological situation. The cause is the kidney qi deficiency. It can be the qi deficiency, it can be the kidney or the spleen or both. It also depends on the associating symptoms: dizziness, blurred vision, tinnitus, low back pain. That's all the kidney. If the patient presents with the loose stool, fatigue, that will be related to the spleen deficiency. The hyperactive fire due to yin deficiency. You have poor sleep, restless, that's from the liver. The hot sensation from yin deficiency. The heart and spleen. So if you have palpitation, shortness of breath, insomnia, poor memory, that's from the heart. From the spleen, you also can have fatigue. So these are some of the common symptoms. Premature ejaculation. Premature ejaculation occurs when during the sexual activities. So it's just the emission comes too quick, or mostly less than 1 minute. So it's considered as premature ejaculation, often differentiated as kidney deficiency, kidney yang deficiency, kidney yin deficiency. So it represents in different symptoms: soreness and weakness in the kidney, in the waist or knees. That's the common symptoms: soreness and weakness in the waist and knees. But for the yang deficiency, the patient will have cold feeling. The patient will have fatigue, pale tongue. For yin deficiency, the patient will have redness, night sweats, tidal fever. That's from the yin deficiency. As you can see from here, how to differentiate different patterns. That's actually we use other symptoms apart from premature ejaculation. So that's why we need to ask different symptoms all over the body to confirm our diagnosis. The last session of the inquiry is the inquiry of pediatric conditions. For the female problems, for the male problems, for the pediatric conditions, these 3 additional sessions are actually the additional sessions on the previous inquiries. So when we see a patient, a female patient, a male patient, we all going to ask them the different questions in these a few videos. And then for female, we will ask the menstruation and leukorrhea. For male, sometimes we will ask about the male's problem. For kids, we will add these aspects for the kids, for pediatrics problems. For the kids, we're going to focus on 2 aspects in the diagnostics. The rest of the inquiries or the rest of the information that we need to consider, we're going to introduce in the therapeutics of the pediatrics when we study the diseases in kids. The first one we're going to focus on is the conditions before and after birth. This is actually the situation of the mother during the pregnancy, during the delivery, breastfeeding, and the mother's medical conditions, the medicine they have taken, and also the labor. So these are actually the mother's situation can reflect the infant's problem, the infant's body constitution, such as if an infant or a baby was delivered premature labor, so these kids may have innate weak body constitution. So that's why we need to ask the delivery. The next part we're going to focus on, or we need to ask, is the history of vaccination and these infectious diseases. The infectious diseases of the parents, such as the hepatitis virus infection, HIV infection. So the vaccination history, because for the vaccination history, sometimes it can help us to exclude some common diseases and also the infectious diseases. It is very important. So these are the discussion on inquiry. Until today, we have finished all the information that inquiries we need to study. So from here, from these a few weeks, these videos, we have studied the inquiries. We also have explained different symptoms according to our theories. So from here, we actually show you in examples how to use the theories to understand the clinical symptoms, the clinical signs. So next time when you see other symptoms, you need to think in this way. How do we understand in our theories? You see, for the acupuncture study, also for the Chinese medicine study, it is very practical, which means, such as I ask you to train the needling technique. That's very important for your practice. But apart from the physical practical training, there's also another training, mentally practical training. That's the way, similar we have introduced these theories, how to use these theories, how to use these theories to analyze the clinical symptoms and signs. So these are the examples. And in the future videos, we're going to introduce the tongue diagnosis, inspection. So those are also practicals. For the diagnostic study, it is a bit different from the basic theories. What you need to do is you need to understand, you need to remember these conditions, and also you need to practice. So for the inquiry, you need to practice the inquiry, how to ask the questions. Now also, until now, we have discussed many clinical symptoms. When you see for these explanations, if you pick up the clues from the explanation, you will see that Chinese medicine or acupuncture, when we analyze diseases, pathogenesis, it is not difficult, or it's very simple. Why I said it's very simple, and then we discuss for 15 or 16 videos, and then I still say that's simple, because when you see the symptoms, you will see that's how we understand the symptoms. No matter what kind of symptoms, you're going to analyze them into deficiency or excess. For deficiency patterns, you need to understand which organs can help the formation, the distribution, the metabolisms of the certain objects that we are focusing on the excess, which pathogens can cause the problems. So such as if the deficiency from the spleen, the patient may present with fatigue, may present with pale tongue, may present with spontaneous sweat, the spleen qi deficiency, and then you will add the symptoms, the main complaints, the chief complaints the patient. If the patient presents with headache, the headache in certain area, but the patient in the meantime they present with loose stool, fatigue, pale tongue, and then we will think that the headache is due to the spleen deficiency. If the patient presents with a headache with stabbing pain, that's the blood stasis, stagnant blood affect in the head area. So that's one's deficiency, one's excess. You will see from deficiency which organs affected. For excess, which pathogens it is. For which organs they affected, such as the kidney. If the kidney affected, the patient will have weakness and soreness in the waist or knees. If the the kidney, if the spleen affected, the patient will have loose stool, fatigue, pale tongue. If the heart affected, the patient may have palpitation, the patient may have insomnia, they don't sleep well, they also can have poor memory because of the heart is the house of the mind. If the lung is affected, we didn't mention a lot about the lung. If the lung affected, the patient may have cough or difficult breathing. Right, so that's how to understand the symptoms. So how we going to analyze the chief complaint plus the associated symptoms, and then these associated symptoms can help us to understand the patterns. So these are for the deficiency situation, and then for the excess situation, you need to understand which exogenous pathogens, such as the coldness, the dampness. If the patient suffers from the coldness, they will have coldness feelings, they will aversion to cold, and they will have yang deficiency. They might have yang deficiency. If this patient suffers from dampness, they will have heaviness feeling in the legs or in the body. They don't want to move. They always feel tired. So these are the tips how to study diagnostics, because yes, as you can see from either from your textbooks or from your notes, you will see we actually have a lot of information under different categories, under different symptoms. How to remember, how to find the branches, the main branches of all these symptoms. That's from the basic theories. We're going to find the branches from excess, from deficiency, from different patterns, from different pathogens. That's the main branches that you need to remember first, and then remember the symptoms and pathogenesis. This will help you to understand and memorize more easier. Okay, so we will stop here. Thank you, guys.